Did you know that in some states, doctors like me have to wait until a patient is close to dying before we can provide an abortion? I'm Dr. Raegan McDonald-Mosley, an OBGYN who includes abortion care as part of my practice. I'm also the CEO of Power to Decide. In the 3 years since Roe v. Wade was overturned by the Supreme Court in the Dobbs decision, the stories I've heard from patients have been horrifying. They're in pain, they're scared, and they're trapped by laws written by policymakers with no medical training. We're seeing people turned away from emergency rooms while experiencing life-threatening pregnancy complications. Survivors of rape, including children, are being forced to give birth. Some doctors are hesitating to provide urgent care, not because they don't want to, but because they fear going to jail. And countless people who just do not want to be pregnant have cruelly been denied the option of choosing what is best for their own lives. This is the reality of a post-Roe America. But the truth is, Roe was never enough. Even before it fell, people, especially Black, Brown, Indigenous, and low-income communities, faced barriers to abortion care. Clinics were closing, and providers were stretched thin. Policymakers were chipping away at access with medically unnecessary restrictions, and too many people couldn't afford abortion care because they depended on public insurance like Medicaid that has been barred from coverage in their state. The right to an abortion may have existed in theory, but for far too many, it was already out of reach. I've included abortion care as part of my practice for over 2 decades, and during my career, I've seen far too many patients who were forced to navigate needless hurdles to make it to my office. And since the Dobbs decision, the chaos that many abortion seekers experience has made it next to impossible for untold numbers of people to get the care that they need and deserve. And here's what else is true. We're still fighting. Abortion funds, healthcare providers, and policy advocates are working to get people to the care that they need no matter what. Organizations like ours are also connecting folks to crucial information and irreplaceable resources like Abortion Finder and Bedsider. If you're angry, you're not alone. If you're scared, you're not alone. And if you're ready to take action, we are right here with you. When they attack our access to abortion, they underestimate our fight and our resolve. But we will never back down.